All right. Welcome to NP's Changing Practice. I'm Dr. Carol Berger.
Hi, I'm Dr. Nina Zimmerman.
So we are so excited today. We're going to try something a little different, and we hope you like it. We hope we hear from you. You comment, email us, and let us know what you like about this format. We're still going to have guests on from time to time, but we're going to also go through some interesting case studies and just talk about them as providers, as if we were your preceptors. What do we see as experienced providers that maybe, we can walk you through our thinking processes and show you resources. Right. So it's important, if you're listening to this podcast, that you also consider watching us on YouTube, because we do have a channel. Subscribe to that. That right. helps us to be able to notify you when we have new things up. And let us know if you like that, because you'll be able to see the case study and walk through it, not just hear about it. Okay. Right. So I'm going to share my screen right now, and me and Dr. Zimmerman are going to talk about a case, and I'm going to show you where you can find these on our website. Okay. So let's see. All right, there we go. Can we see our website? Yeah, we can.
Yeah. Right? Yeah. Okay. The website's great. You guys really have to visit. There's so much there.
So this is npschangingpractice.com. And like Dr. Zimmerman said, we have our podcast here where you can listen to what we talk about. We have lectures that are free. You don't have to pay for them on their patho, their pharmacology, and we keep adding to that. We have educational games, which are meant to help you. We're soon going to have, so be watching for our little logo, which is NPCP, for our downloadable games that you can get on Google app. So that's going to be coming. We have clinical pearls, which are just the zebras in those cases that are just super interesting, and they have a weird twist in the end. They didn't end up being what you thought. We have just regular case studies, and we have some CEUs that we feel are important, and we keep adding to that website. But where we're going to take you tonight is into the day of a life of an FNP. And what we're going to do is expand this to be a day in the life of a psychiatric nurse practitioner, a day in the life of an acute care nurse practitioner, Gero, and all the different tracks of an NP, so that you can click into there. And we're hoping to build more and more cases, and we need your help. So we're going to take you through one of them, and then we're going to tell us how you can help us build our library to help future NPs. Okay, so these are all taken off of cases that were interesting to us. It's difficult to just come up with a case that you never had before. Okay, they're just kind of difficult. So in here, this is in the day of the life of an FNP. Now, we only put 10 patients a day. That's not realistic. Okay, you're going to see double that. But for purposes of our library, we only put 10 in at a time to see. We might build that out later. But today, what would be a good one to look at, Dr. Zimmerman?
You know what? I'd love to know about migraines. Maybe I can even add to that one. Yeah.
All right, so let's go in here. And this is Raven. We're going to see her at 9:40. And she's going to first, when we start here, these are animated files, so you get a tiny little clip of what Raven has come to see us about. Then we walk through the chart by, it is an interactive PowerPoint, so you can click on things and you can go back and forth in the chart just like you were an FNP. So let's see what she says.
Hi, Raven. What brings you in today?
I think my migraines are getting worse.
Is your headache throbbing?
Yes, it feels like a drum inside my head.
How long does a headache last?
Most of the time, at least 12 hours, and sometimes up to 2 days.
Do your headaches occur on one side of your head or both sides?
Always on my left side.
Do you experience nausea or vomiting with the headaches?
Yes, I am always nauseated, and sometimes I vomit. That seems to help.
Are the headaches so bad you're missing work or school?
Yes, I have had to go home from work a couple of times last month.
What makes you say they're getting worse?
I used to get them before my period, but now I'm getting them every week.
Well, let's take a look and see what's going on.
So we got some interesting information there. Dr. Zimmerman, what stood out to you?
Well, what stood out to me for sure is that they're getting worse. They're interfering with their daily life. It's one-sided, and she's got other symptoms, like she's nauseated and vomiting, and maybe she even has light sensitivity, all pretty typical of a migraine, but we still need to do further investigation to figure out if it's really that.
Yeah, and I mean, she is talking about this is a typical headache that's one-sided, so that
Yeah,
supports a migraine versus a cluster headache versus a tension headache.
right.
All of that. So let's take a look and see. We've got our chart here, so let's take a look and see if there's any more clues. What we have so far is we're positive on probably a migraine with an R maybe, or without. We're not sure. We need to question her more.
Uh-huh.
Just get nausea, vomiting. That supports the migraine. Having it left-sided supports the migraine. It was hormonally kind of triggered, it looks like, but now it's getting worse. It's
Yeah.
happening more often. So it looks like we're following down a migraine path that's worsening, but let's see what medication she's on. So she takes propranolol, 20 milligrams BID,
Mhm.
is a prophylactic medication for migraines.
Yes.
So that right there. Now, then she's taking Fioricet, one tablet every 4 hours as needed for a headache, and she's taking it twice a day.
Yes.
What makes you concerned about that?
I'm concerned that she's taking it twice a day, and she's taking it probably consistently, and it's not helping.
Well, and Fioricet has caffeine in it.
Oh, yeah, sure.
And so if she's taking Fioricet twice a day, and maybe she has an energy drink, we don't know. We haven't asked her. Maybe she
Yeah, that would be concerning.
maybe she
Yeah.
has an espresso in the morning. So these could be migraines that are now exacerbated by caffeine. So
By the caffeine. Yeah. Yep. I've seen that. Yes.
we got to put that on our list of, that would be something we'd ask her. How much caffeine are you drinking? And the propranolol is suboptimally dosed.
Yes.
However,
Yes.
I mean, I think it recommends 60 milligrams twice a day,
It
but
can go up to 60. Yeah. Yeah. You have to watch your heart rate or blood pressure, but yeah.
So let's click into more information and find out what we've got. So this tells us that propranolol is prophylactic, right? As well as we could use amitriptyline or Topamax, but Topamax is a class X for pregnant.
Yeah.
So you really want to make sure if they're on Topamax, they've got a reliable form of birth control and not
Right.
just a birth control pill. And Fioricet, we're talking here, the has 40 milligrams of caffeine. She's taking it twice a day, so she's getting 85 milligrams of caffeine with that, and a cup of coffee has 95. So
Yeah.
just something for you to be aware of. So these are some more clues. Let's get a little more information. Past medical history, she just has migraines. So that's kind of good. Now, some things here we need to know about are the cautionary things that you can find in more information. There's two types of migraines, one with an R and one without. We haven't questioned her enough to know.
Yes.
Right? But if she has an aura, birth control is contraindicated. Oral birth control.
Yeah.
So if she has an aura, we don't want to prescribe her oral birth control. We have to use it different things. Okay. And then without an aura for people over 35, we tend to not want to. So this is birth control is contraindicated in patients who have a migraine with aura and those without aura who are greater than 35. And that I find, I don't know about you in your practice, but I find that typically that isn't asked and birth control is typically prescribed.
Right. Right. Very common.
So this is a problem because we're talking about a vascular issue and, birth control can make you have more blood clots.
Yep.
And has issues with that. So that would be something, and it is in there. If you want to look up more information, you go to Up to Date and look up the contraindications to birth control. You can also go to Hippocrates and look up the contraindications to birth control.
Yes.
So immunization, she's all up to date on that. You could recommend a flu shot and COVID-19 per CDC guidelines, right?
Yeah.
Review of symptoms. Now let's see, are there anything here that are concerning? No weight loss or gain, no nasal congestion, stuffy nose, sore throat, no complaints of shortness of breath or wheezing, chest pain, dyspnea on exertion, is complaining of increasing migraines from
Mhm.
once a month to once a week that have increased in intensity.
Yes.
So our concerning symptoms, we just are trying to help you see, did you pick up what we picked up? Okay.
Right.
And we are also reiterating that the 2 Fiorasid a day, we need to investigate more. All right. So let's look at our vital signs. Blood pressure,
A little high.
a little high. Pulse is okay. Now, if her pulse had been like 120, we would be like, "Ooh," the caffeine is definitely causing a problem.
Absolutely. Or if it was too low, we'd be worried about, the beta blocker too.
Beta blocker, right? Absolutely. So, like if we were like 90/60 blood pressure, then we would be like, we need to back off on the,
Right.
the blood pressure medicine. Or if her heart rate was too low,
Yes.
it was like 45,
Yes.
that would be another thing. So want to look at our vital signs because she's on a beta blocker that could slow her heart rate or drop her blood pressure too low. And what else is she on? She's on propranolol.
Propranolol, and all she's doing is propranolol, prophylactically, and
Caffeine.
Fioricet. Yeah.
Caffeine could make, if she's got too much caffeinated beverages. And I don't know that the Fioricet alone would, but these energy drinks can be kind
Oh
of,
my gosh, it's so important to ask that history. So important, because that could be a reason why people are coming in tachycardic or anxious, or, really important to assess that.
and I know my son, and I mean, I get on to him all the time, but he's on ADHD medication. He's in
Uh-huh.
he's right. So he's on the medication that can raise your heart rate, and he still drinks a couple energy drinks a day.
Yeah.
But
Yeah.
sometimes he does go to bed saying that his heart is racing, and I'm like, you need to stop that. So
Right.
these energy drinks and energy products, because it's not just drinks, it's products.
Yeah. The products, the little ones that you can
Pills.
just little shoot things, little
There's
shooters.
little candies you can take. and
Yeah.
things like that. So we've got caffeine in a lot of stuff. So we need to remember that. So anyway, this is the rest of it. She looks about the right weight for her
Yep.
height. That's not too bad. Her oxygenation is good, no temperature, and everything there looks stable. She's a little hypertensive, so the propranolol is not bad, right?
Right.
More information, her blood pressure is mildly elevated. She is got a BMI of 23.3, which is her normal weight range. And we've built in different guidelines to show you where to find things.
Yes.
JCN 8 guideline is a hypertensive guideline. So you could click right into here and
Right.
it would tell you that she is greater than 18.
Mm-hmm.
Right. And then we follow down here. She's not got diabetic. She's not got chronic kidney disease. Our blood pressure goal is less than 140/90, which she's not there.
Right.
Okay. So she's at this point and she's on a beta blocker,
Yeah.
which should be helping her. So again, another good reason to check out the caffeine, and we might need to add an ACE or an ARB. So it
Mm-hmm.
just tells you our lifestyle changes. So great resource. Okay. So that helps you there. So we've done that. Now let's see what we see when we see her. She looks well. Her sinuses are non-tender, which would be important, right? Because she could have a sinus and headache.
Right.
Thyroid is midline. Everything else looks good. Ears are fine. Lungs are clear. Cardiac is regular rate and rhythm. Skin. So basically she looks pretty good.
Right. And thank goodness all her neurological's intact, because, people start to get worried when they have increasing frequency in their migraines and they start thinking they need scans of their heads. And we don't do that just because we got, worsening headaches, right?
Well, it just depends too. So let's look here.
Mhm.
Criteria for migraines that we've got it right here. Way small. I wonder if I can make that bigger. What do you think?
It's a PDF. I'm not sure.
Let me see if I can just make the whole. Tell me when you.
There you go.
Ah,
Yeah, there you go.
Are we getting there? Sort of,
Small.
that's kind of too much blurry, but you
Yeah.
can look at it. But this is in up to date, and it's a headache assessment tool.
Right.
It will tell you with or without or and what tests to run and what you need to do.
Mm-hmm.
Oh, so in this person's case, what do you think our options are? What would we do with her in clinic? Her headaches are getting worse, so they've changed.
Mm-hmm.
We would assess her for caffeine. That would be my first thing. If she told
Yep.
me I would try to wean her
Make
off.
sure she doesn't, make sure she doesn't make criteria for a scan.
Right. If she did meet the criteria for scan, we'd repeat a CT scan.
Definitely consider her caffeine intake.
Right. We would want to wean her off the Fioricet or get her off the Fioricet. We have a couple of things for her headache to keep her from getting it. We have a prophylactic, which is our propranolol, or we
Yep.
could change it to amitriptyline.
Yeah.
Or we could change it to Topamax depending on her birth control.
Right.
Right. And Topamax, we have to be a little careful with, but we could do either one. Or we could increase the dosage of her propranolol. I mean, her blood pressure looked like it could sustain that. We could
Absolutely.
move it to 40 milligrams twice a day, but that's our prophylactic. She needs an abortive.
Yeah, she really does.
That isn't the right one for her. What would be
No.
the next, what should we give her?
Oh, I would consider a triptan.
Right. And that's what I would say, I would probably find Max Salt or something like that.
Yeah, whatever's reasonable.
Right, and whatever her insurance can afford, and I would give her that as an abortive, and they can usually use it once and then use it again within an hour if they haven't. The different ones are, but a triptane would be a better abortive than
Yes.
this. And so then if she's positive for caffeine, like you said, taking in too much caffeine, if she's positive for that, then we would wean her off of that and say, look, you need to drink a ton of water.
Right.
We need to get you off the caffeine, and maybe not stop it all at one time, but let's stop the Fioricet and then let's cut back on the coffee or the energy.
Right.
More water to get her off of that. Rebound headaches in my practice has been from too many NSAIDs.
Yep.
And too much caffeine.
Right.
So that's probably my guess, given her age and everything. That's probably now
Could be it could definitely be that. And a couple other things, I would feel comfortable with the triptan, but you have to educate your patient. You don't want to take any more than 2 in a 24-hour period, and you want them to hit it hard. Some patients, they think, oh, I'll take a half of my 100 milligram triptan, when you really want to hit it hard when you really know that your migraine is coming on, so that it helps right away, and figure out if there's other triggers in that regard.
Well, and now if she came in and said that her headaches were just before a period and now she's having a headache that's so bad it's making her vomit every day, that's criteria to re-CT her. I mean, she could have
that's true.
What is that called? A Shari malformation.
A Shari malformation, yeah.
You could have that, and that could be kind of been pressing. So she could have a tumor. She could have different things that are causing things to be different. So that would be a more concerning cause. But other than that, and the birth control, what would you do if you found out that she was on birth control and she's over 35?
Yeah, you wouldn't be able to do the Topamax.
Right, and you'd also need to consider.
You have to consider pregnancy, yeah. Mm-hmm.
So all kinds of good questions, and we have a couple things here to check for understanding. Does the patient meet the criteria? And then you can look at the rationale for what we've got, and that comes from up to date.
Yeah.
So
for you all listening, she wasn't meeting a criteria for a CT because she wasn't having the neurological symptoms that you'd be worried about. But you really have to watch that and really look at the criteria, whether you're going to scan somebody. A lot of patients want to come in and get scanned all the time, but you really want to make sure it's appropriate.
Right, and Up to Date is a great source to tell you when to CT and when not to, so you can go and see what, good rule of thumb is if it's changed considerably in its presentation, then you worry there's something new.
Right.
But
the other thing about a triptan is it does vasoconstrict. So I had a patient who had a triptan, it was working great, and then he had a status, migraine attack, was hospitalized. They found an aneurysm, brain aneurysm. And so we had to take them off the triptan because it vasoconstricts. So, you know, you do have to remember the action of that medication. And if your patient's on that, you want to assess for, you know, side effects, if they're having any chest discomfort, or God forbid, they have any kind of other situation where you don't want them to have vasoconstriction of their blood vessels. So something to keep in mind.
In my, I always would get the CT of the head if they were new migraine
Mhm.
before I gave the triptans, just so that I would be okay.
That's good practice.
And that I felt like better give them the Fioricet or something and get the CT first. And now if the headache never changes, it's just changing in frequency, and it's not that different. I mean, like in this case, we could probably guess that she's doing too much caffeine and
Yeah.
she's got rebound headaches. So we
Yeah,
don't
certainly if it was getting worse, you're right. And an initial migraine assessment, I think it is, you could get a CT, but I don't always do that. It just depends on the patient. Certainly if it's new and it's pretty aggressive, I would consider it.
And there's some great resources out there for you to differentiate between a cluster headache, which
Yes,
my father had cluster headaches. So
yes,
I know that one. And that one is, they used to call a cluster headache a suicide headache.
yes, yes. And it could be typically more with men, but women do get them too. But you know, typically you'd see it more in men, and morning, and possible, you know, nasal drainage with it, and different symptoms with that.
The nose gets all blocked up, the eye
Yep.
gets droopy on one side. They're
Yep.
very, and they complain of severe. My father always described it as an ice cream headache behind his eye.
Yes, yes.
And
Ice
that's
cream,
what
yes.
it was, very sharp, but it was enough, and it was painful enough that it would drop him to his knees.
Yeah, it
and
can be pretty significant.
multiple times a day. He would
Mhm,
have 10, 12 of them a day, so
mhm.
it's very debilitating, but they come in clusters. So they come for like 3 or 4 days and they're gone. And these patients, they try to figure it out forever. Is it the seasons? Is it something I'm eating?
Right, right.
It's not, it's just a cluster headache, and they're treated very similar to migraines. So-
Yes.
So good resources for you and up to date. And then what I also wanted to share with you, let me see if I can do that. I want to share with you. Where is that at? Okay, there we go. Stop that share. And let me share with you our, where's that? There it is. Our website is npschangingpractice.com, where you can find these case studies. And if you have an interesting case that you've seen in preceptorship, or that you are an NP and this was a really interesting one for you, send us the information at cberger@npschangingpractice.com, and we will animate it and put it up on our site to help other students as they're going through their practice.
Yeah, and if you drop us a line and have something interesting that you want us to discuss, if we get a couple emails, Carol, maybe we'll talk about that in another session. What do you think?
Yeah, absolutely, because we need to know what topics you're interested in, what you
Right.
come up with, and we'd love to have the feedback. We love to know how we're doing, and so please tune in, like us, subscribe us, so that you get our announcements when we have a new episode coming out. And we're going to keep bringing things to you about NPs who are changing practice.
Yes. Thank you. Have a great night.
All right, let's see. There we go.